So I know a lot of you saw what happened.
Renee, are you all done?
What happened to Patty Cake
Okay.
this afternoon. So he was on the counter, and Jackie S., our volunteer, had been petting him, and shortly after she walked away, he kind of collapsed and fell down. His back, it looked like his back legs went out on him, and which led to his uncoordination, and he fell over and landed on the floor. So I got a phone call, of course. Our mods are always right on it. And I called here and had Lynette put him in Dodger's pen, and that's where he's been since then. So you all know we lost Patty Purr not very long ago, and that was deemed to be the cardiomyopathy. And you know, both of these boys have had cardiac murmurs. Oh gosh, it's been years. They were born July 31st. He just had his 8th birthday on 2010, so he just turned 8. And in 2013, we already knew they had heart murmurs, but you don't always have to treat them unless there's more symptoms than just the murmur to treat. You don't want to overdo that. So everything has been going on, and you know, for years now, almost every time Dr. Darcy comes, she always does a health check on both of the boys to make sure that their hearts have not progressed. Sometimes they've been like 4 out of 6, still with no symptoms. You know, we watch the color of the cats, and we keep track of the respirations and the heart rhythm. And they had always been okay, other than the murmur itself. And then sometimes it would back down to be only like 2 out of 6, and again, never with any showing visible signs of having any problems. And then when Patty Purr passed away, you know, Dr. Darcy felt 100% confident in saying that that was the cardiomyopathy, and in cardiomyopathy, it's the heart starts beating irregular, and they throw clots, and that's what usually they die from, is the clots. They can go to the brain, they can go to the lungs, and I would rather those two things happen than sometimes they go into the saddle block area, which is your hip area. And when that happens, those are hurtful, those are painful, and they become paralyzed pelvis down. And the ultimate thing on that usually is euthanasia, because by that time the clot is fairly big and it's hard to dissolve and the damage is done. Yes, tomorrow is Patty's birthday. He's been in Dodger's pen since then. He has been open mouth breathing a lot. His color has not been good. His respirations are accelerated, although I think right now they've come down a little bit. And I was so happy that about 4 or 5 months ago, Dr. Darcy helped me buy a really good cardiac stethoscope, and boy, you can hear so much more with those. And his heart is not working very good right now. So I was with Steve at the hospital at this time, but as soon as I got home, I listened to him, called Darcy, and I rarely call her at work, and they got her right away. And they said too, they know when I call that I don't call unless it's an emergency. And Darcy said it has to be this cardiomyopathy again. So we've started him on the standard treatment, which is an aspirin to help keep the clots dissolved. We started him on Vetmedin, which is a heart regulator. I gave him Lasix, which will help get any fluid out of his lungs. And this is always stressful and sometimes painful. So we also gave him Torb. There's other pain meds that we use, but for this particular thing with cardiomyopathy, Torb seems to be the thing that is very helpful in helping cats, one, to relax, and also to deal with any pain. So right now we've got him covered. I don't know what's going to happen. I did get him out to watch what he was doing, and his back legs are still very weak. Couldn't keep his weight up on him. He kind of went down again in Kitty Cabana, in case you were watching that, Cam. So we're in a wait and see. I don't know what's going to happen. Dr. Darcy, and I mean, she's told me this a long time, because we've had other cats with this. These are not a good thing. This is not a good thing. It's a serious situation, and they don't always pull out of this, or they sometimes get better, and then wham, they get socked with another embolism or clot. So we don't want to lose this boy. We got to keep him. We want to keep him going. So right now he's relaxed a little bit more. That's probably from the torb. He's still got his mouth open, so that just helps him breathe better. And we'll see what happens. We'll keep monitoring him and go from there. And I know right now somebody's going to say, well, shouldn't you get him up there for a chest x-ray and an EKG? We're not going to do that. Dr. Darcy already agrees with me on that. We know what this is. I am not going to put him through the stress of driving him up and adding more problems to what we already have here. We're fortunate that we have a vet that knows these cats. She's been listening to their hearts for years, and we're fortunate to have the meds that we need here. So normally when Dr. Darcy says, do this, do this, do this, that we have the meds to do that with. So we've got everything on board in him that she wants, and we'll just go from there. Bottom line is we want to keep him around, and we don't want him to suffer at all, and we will keep up on all those medications. So if you have any questions, pop them up now, because we've got a busy rest of the afternoon with surgery checkouts. I'll give you a minute to pop up there. Anything you want to ask? His weight has stayed the same for years. Everything has been very good and very normal. Well, I'd rather come and talk to you all about things like this so that rumors don't get started, and that you know the actual happenings, that you're not second guessing or second hearing it from someone else. I'm always upfront, and I'm very honest with all of you. Oh, LG, yeah, things have been better. That's all I can say. I think one of the mods is videoing this, and so you can go back up after they post it. That way I don't have to repeat all that. And he's comfortable here. He's, you know, it's his home. So, you know, we're hoping that all these meds will kick in, and that we have a lot more time with him. Just a lot going on, yeah. So, feel free to email me, whatever, if you have any questions, and I'll keep you all posted. On a better note, we had an adoption this morning, Virginia and Neil got to go to their new home. Thank you, LJ. Thank you, Lost Girl. Oh, I will. I will. He loves us so very much. He's such a handsome boy, isn't he? Yep. Appreciate your prayers and good thoughts and lots of hugs. Right now we're just doing one day at a time for everything. tomorrow, just as a heads up too, we'll probably have 2 more adoptions. That'll be probably, sorry, I can't think, Jobella and, Prentice, or Jobella and Zerpel, one or the other. You're welcome, Goosey. Yeah, they love that.
Oh, I have to-
All right. Well, you all take care. And no, it wasn't a seizure. No, no. All right. You all take care. And I'm waiting word from Humane Ohio to see when they will be here. Take care now.